I would have to do them 5 days a week for 30 minutes if I wanted to do anything else, which thank you, Mom, for that. It was because it paid off.
Hey everyone, it's Physio Andrea and welcome back to TSC Connect. Today we have an interview with Hannah, who is one of my first clients at the ScoliClinic, and she has a lot of wisdom to share. So today in our interview, we touch on her scoliosis journey and her experience up until this point. We also talk about some strategies that helps her to stay on top of her exercise plan and her treatments over the last 5 years. If you haven't, check out her case study that we posted about on our Instagram feed. It should be in our highlights. She graciously allowed us to use her photos and x-rays to do some teaching for postural identification and also break down some of the measurements that us therapists look at on the x-ray. So let's get to it. Here's Hannah. Hannah, thank you for joining me today.
Thank you.
I wanted to start with a question. Before COVID started, you decided to take a chance, do some courses, and start your own solo venture. Tell me a bit more about that.
So back in September of 2020, I decided to take a course to do eyelash extensions. So that was really fun. It's been super good this year, having something to kind of like focus my time on throughout COVID, where there hasn't been much to do, and kind of be creative with that.
Yeah, and then you finished your courses and then got your own home studio started, and then COVID hit. So tell me, like, how did COVID affect that venture and even like your excitement about it and your momentum?
It definitely affected my motivation, I think, to go into something, because there was so many restrictions holding you back from being able to kind of like expand it to its fullest potential. But I've still really enjoyed being able to have like people that are close to me and practice on all of them.
Yeah, it definitely slowed down a momentum for a lot of things.
Mm-hmm.
How would you say COVID affected the momentum of other parts of your life? Like, so we'll talk a little bit more about your scoliosis story in a bit, but overall, like your mental health or your emotional health, and how did it affect you physically as well?
It has definitely affected my mental health a lot. Again, with motivation, especially being someone who really enjoys being busy, not having that for so long was just so different than anything I've ever had to do before.
Yeah, from knowing you for 5 years, I looked back at your chart, and I've known you since 2016, and I know that you are so social and really love to be involved with your friends.
Grad was probably the hardest thing throughout this for me, because I was so excited for it for the longest time. And then when it kind of hit right before all of that was going to happen, it was definitely tough. It was tough, like also with my family and stuff. Like I'm the oldest grandkid, and then my grandparents didn't get to watch that happen. But we just celebrated with what we could do at the time. And honestly, it was so fun. It was like, we really made the best of it, and it was such a good grad season anyways. So yeah.
Another thing that came up during our sessions together is that I remember you mentioned that you have gotten closer with your sister over COVID.
Yeah.
Because you ended up spending a lot of time together. Tell me about that. Like, what was your sibling relationship like?
We have both always been super busy, her more than me. She dances like 6 days a week. So it's just, we never really got to spend that much time like together all the time. And I don't even know what I would have done. Like if she wasn't there, I would have been so bored throughout COVID.
Yeah, it is. I think it is a silver lining, because I realized that there were lots of families who COVID created a very big stress in terms of, parents losing their jobs and things like that. So it's really nice that your family took advantage of that and was able to just take advantage of the fact that you could spend time together, and then really did.
Yes.
Yeah.
Yeah.
So, yeah, let's talk about the physical. Was it during COVID that you got your job at the office, or was that
It was,
before?
yes, it was like pretty much maybe 2 months after COVID. So I worked an office job from May until October, I believe. I was working like 5 days a week all day. So definitely took a toll on my physical health, especially with my back, just being someone, I was a dancer when I was younger. So I kind of had that active, everyday type of lifestyle. I was, of course, sitting in a chair all day, every day. And I didn't really notice at the start, but it definitely affected my back quite a bit, just not moving. And I think that's always been something that's kept me feeling good and not stiff and really not having much back pain for the first years of going through scoliosis. I really never experienced it that much. And I know in the future that might be something that I will steer away from. Yeah.
Yeah. What were some of the things that you experienced that you noticed as time went on in that desk job?
I think definitely just like the stiffness feeling was probably the worst. Is just you're sitting all day every day. There wasn't much movement. I was antsy all day every day. I wanted to be up and moving. On my lunch break, I would go for a walk for 30 minutes to try to give myself a little bit of something to get my body moving. And yeah, and then I noticed it affected my lower back quite a bit, just being in that sitting position all day. And then
And we tried a lot of strategies.
We
you
did.
were really responsible
Yes.
about it, that you had asked me of like, are there things that we can change
Yeah.
about so what were some of the things you had tried that maybe gave you a little bit of relief?
One of the things that helped a lot was I could have got like a actual pad for my lower back, or I know you can buy them on Amazon, that type of thing, but I just brought like a sweater with me every day and just positioned it in my lower back, and it kind of just gave me that like a little bit of lower back support, which that helped a lot, I can tell. And then another thing was not crossing my legs when I'm sitting.
You noticed that changed, that made a difference?
Definitely. And it kind of just it just gives you more support when you're not leaning to the one side, putting the one leg up. And then as well as, like I said, like going and moving at lunchtime instead of just going and sitting and eating, just kind of getting that, like breaking up the day a little bit, definitely really helped.
Yeah, those are really good tips. So let's go back. So as we had posted in the Instagram story, and thank you for being willing to share those photos to help other people learn. I used your posture photo from the first day that we met back in 2016, and it was your initial assessment when I believe you had just found out that you had scoliosis not long before that. Yeah, like how did it feel when you first found out that you had scoliosis, and how did your family feel? I know that you and your parents are quite close, and yeah, tell me more about. Let's go back to 2016.
So yeah, it feels like so long ago now, but I do remember it so clearly. I remember the first, I went to my family doctor with, it wasn't even back pain, it was because I did ballet. And my ballet teacher always told me, like, you have to tuck your one hip in. And I was like, I can't tuck my one hip in, like, no matter what I do. So my mom just brought it up to my doctor, and then she took one look at my back and she was like, oh yeah, you have scoliosis. And I remember thinking, because before that I had really never had anything like that I had to deal with. So it was definitely a lot of anxiety, just having no idea what that meant.
Had you heard of it before?
I don't think I had, to be honest. Like I could have, but I didn't know anybody with it. Now I do. I have a close friend who has scoliosis as well. And then of course all the girls that I do the group class and everything with, but I didn't really know exactly what it was. And I think just most of the anxiety was I didn't know what it was going to mean for the future and for the next couple of years, like what I was going to have to do to deal with it. And then going to physio, and physio was just such a, like, it made it feel so not scary. Like it was just like a comfortable, like, oh, just going to physio, like, and kind of make it a, like it was like an activity. It was like an active, I was just going and I was working on my own health and all of that stuff. So I think that once I kind of got into that routine of doing that, it just kind of became like second nature, like, oh, I'm going to go to physio, I'm going to do this. And that was definitely when it kind of started to get comfortable and less scary for me.
5 years ago, you would have been how old?
I think
15?
I was third.
How old are you now?
I think I was 13. I'm 18. I'm
You're
turning
18, okay.
19 in August.
Got it. Okay, yeah. So you were 13 at the time.
13, I think.
Yeah, and you've always been really mature for your age.
Thank you.
But when you were 13, so you now at 18 look back and realize that what you felt was anxiety. When you were 13, did you know what that was?
Honestly, I'm not totally sure what it felt like for me at the time. Now I know it's anxiety, but back then it was just new, and when you're 13, I feel like you're so wrapped up in everything else that you're doing. Like I was busy, I had all these things, and then all of a sudden you have this thing that you have to deal with, and that's, like you have to deal with for your own health and for yourself. And so I think that was definitely just a weird transition kind of thing to take on. 13-year-old me probably didn't know that I was just stressed about it.
How did your parents, because your parents have also been really supportive through the whole thing.
Yes.
Being willing to drive you to physio appointments and all your other appointments, and also just really encouraging you to stick with your exercise program, which we'll also talk about. But what were some of those early conversations like with your parents?
They were so supportive from the start. I think both of them were kind of a little bit, I don't want to say scared, but they were like, oh, it was also new, and they weren't really sure either what was going to happen next. But like my mom putting me in physio, and then I'm sure we'll talk about this later too, but really, really being on me to do my exercises, which at the time when I was like 14, I did not want someone telling me what to do. But now I'm so thankful that she did, because it made like all the difference. And really, she just cared and wanted it to get better for me, and she just knew that before I did.
So let's talk about your exercise program, because at that time I recall your curve was changing, like you were still growing. So we weren't sure how much your curve was still going to progress. And so we set you up with a pretty thorough exercise program. And the research says that you should teenagers should be doing exercise around 6 days a week for like 30 to 45 minutes a day, but that is very difficult.
It is.
And over the last 5 years, I would say, of course, there are some like ebbs and flows with it, but you've been pretty consistent with your exercise program. So what strategies did you use to actually do that? Like, how are some ways that helped you actually stick to that exercise program? Because that's one of the hardest things for all of our clients of any age, is to actually do the exercise at home, understandably.
Yeah. So when I was doing them the most, I was probably 14, maybe 15. And I would have to do them 5 days a week for 30 minutes if I wanted to do anything else, which thank you, Mom, for that. It was because it paid off. But then it kind of got to the point where after that too, that I was seeing it paying off. So then I was just like, no, I'm going to do it. I could see the like symmetry in my torso, for starters. I could see it for the first time, and it felt like I was like building muscles around my spine, and I just felt better. I felt just more active, and then more like I was standing up straight. I was sitting up straight all the time. I was never really like slouching. I felt as though I had good posture. So it those were the sort of things that I could see it was paying off. And then my exercises became easier. And then getting another x-ray was when you actually saw like physically how much it had made a difference.
Yeah, and your curve had stabilized, and not only
Yes.
stabilized, meaning it didn't get worse from that previous
Yes.
x-ray, but it actually did improve a little bit.
Yes.
So that was really, I remember at the time when we got that that updated x-ray, that itself was really motivating to see.
Yes.
Like not only
'Cause I
could
just
you
wanted
feel
to
it, but you
keep,
could see exactly.
I just want to keep it up.
Yeah. So what were some of the things that helped you stick to doing exercises? Of course, your parents like encouraging you
Mhm.
and giving you some pretty strong boundaries around like, if you want to do this, first you have
Yes.
to do your exercise.
Yeah.
What else?
Just going and working out has never been something that comes super easy to me. I kind of have to push myself to do it, but the way that you feel after is just so good that I think that's something that definitely motivates me, because you just feel your body feels great after you move and exercise. And I just kind of incorporated physio into any working out or activity that I did. If I went to the gym when I was maybe like 16, I was going to the gym somewhat consistently. And every day when I came home, I would just, after I worked out, I would do my exercises and then hop in the shower. And that was just the routine that I had.
Mm.
Um, as well as before every time I was at physio, I wanted to make sure that I was like keeping up with what I was doing so that I wasn't like falling behind, and I was kind of like just holding myself against sort of a routine.
Yeah, accountability. So do you think,
Yeah.
yeah, because I remember early on, you had really committed to coming weekly, and we did that for quite some
Yes.
time.
Yeah.
So that's another barrier or a challenge that a lot of families have, is like rearranging their very busy lives to find
Yeah.
time to fit in these new appointments. But do you think that that was helpful for keeping you on track, that regular touching base with me on a weekly basis?
Yes. I think one of the biggest things that I can say is consistency is so important. And consistency, even if it's you at home being consistent with yourself, or if it's going into physio once a week.
Hmm.
Yeah.
You also have a really great home exercise setup.
I
So
do. Yeah.
you have a nice little space that you have a wall ladder similar to this one,
Yeah.
and a bunch of other equipment. So would you say that having that like how is that played into your exercise adherence?
It's helped a lot. I That's one of the things, like when we were talking about how my parents have been great through all of it. My dad built the ladder, which was awesome. And it's kept up through 5 years of me using it. So yeah, that's been great. You know, when you have all of the physio set up at your house, it's like you may as well use it.
Yeah, and I think it decreases that extra barrier that some, it's like,
Yes.
oh, I should do my exercises, but then I have to clear the space and set everything up. So
Yeah.
I'll do it later. Versus
Yeah.
if it's all set up there in front of you, it's kind of like
Yes.
there's not a lot of reason to not. You
For
can just
sure.
lie down and start doing some of your exercises.
Yeah, and I think like even though I'm very lucky that I have the ladder, even if you just had a space, like a corner that you dedicate to, that's where you're going to do your exercises, that's where it's going to happen. It just motivates you a little bit more.
Yeah, totally. In the last 5 years, you have had a lot of medical appointments. Is there anything that you want medical professionals to know? Because we've also heard that a lot of families will say it's a pretty stressful experience. It depends, of course, on the doctor, but some physicians don't, or some healthcare professionals in general don't always explain what they're doing, or it can be a helpful
Mhm.
experience, but it can also be stressful. So is there anything that you would want us, as the people providing the care and providing some guidance, is there anything that you'd like want us to know?
Sometimes when it's like you're going into the hospital or a doctor's office, it's just a little bit more intimidating and you're already uncomfortable with what's happening. And I think there's a big emotional side to it as well. Like it's scary, and you're just unsure. And I think especially like the first time going to see the surgeon at Children's Hospital, I think just taking into consideration the like emotional part of it, especially for teenagers and stuff, you just have no idea what to really expect. And just making it as comfortable as possible, which most places that I have been are very good with that.
How would you feel more emotionally comfortable in a place? Like, what are some small things that you've noticed that could
Um,
contribute to that?
at physio, I think a big part of it is when you're going there and there's other girls your age who are going through the exact same thing as you, and I think that you can kind of relate to people. And then all of the physios that I've met, they're very good with like understanding that it's difficult for you. And I think that that's one of the big things, is just not talking in super technical terms and everything, just kind of um, explaining the things to somebody like you're talking to a teenager who is, unsure of what's going to happen next.
And it's so true. It's something that we have to, as healthcare professionals, we have to consciously make that choice in every
Mm-hmm.
conversation,
Yeah.
what wording we choose and what tone we choose, and depending if what age of people are in the room, and if English is
Mm-hmm.
their first language or not,
Yeah.
or what their level of understanding is. I agree with you that I think it is the responsibility of the healthcare provider
Mm-hmm.
to be so careful with delivering that information,
Yeah.
because if it's too technical, it'll just go
Mm-hmm.
like way over your head and not be meaningful at
Definitely.
all.
Yes. And when you're talking to someone, you're talking to them about something that affects them every day,
Yeah.
like
So
and
being more
I think
sensitive
that,
to that.
yeah, for
Yeah.
sure, I think is that would make a big difference.
Yeah.
Yeah.
So over the last 5 years, like, now, of course, you know that you'll have scoliosis for the rest of your life. How
The
have
rest of
you
my
kind
life.
of come to terms with that this is part of your life, and how can you still continue to move forward?
I think that, like, it's something that I'm going to have to deal with the rest of my life. I'm just going to have to incorporate it into my daily routine. And I think just kind of, again, holding myself accountable for keeping myself in a routine is going to be a big different or is going to make a big difference in kind of going forward. It's one of those things. I'm going to have to deal with it for the rest of my life. But again, there's worse things that you can deal with. And I think just knowing that I'm not the only person who's dealing with it, there's so many other people as well. And um, it's just kind of like, you know what? It's okay. We'll all do it together.
Yeah, yeah. So after you had done enough of those one-on-one sessions, you started doing
Yeah.
group class, where you were coming fairly regularly, and we had a really consistent crew of like 4 girls that were around
Yeah.
your age who were kind of going through the same thing. Like, what was that like?
At the beginning, it felt like I was the only one who was going through it. I didn't know anybody else. And then going and kind of making it a fun thing. Like we were all just doing our exercises together. Like we knew what was going on in each other's lives, all of that stuff. You have people to relate to, either in high school like you. And I think that, yeah, it was just so comfortable to be around people going through the exact same thing.
Yeah, I kind of normalized it almost,
Yeah,
right? And
definitely.
then I remember when we were doing those regular groups, when you would all come, your scoliosis, sure, it was the thing that brought you together, like made you all be in the same room,
Yes.
but we talked about so many other things than just
Yeah.
scoliosis. Sometimes we actually didn't ever talk about scoliosis other than the
Yeah.
exercises. So I think that was really important. You're right. It's like normalizing it.
Yes. Yeah, and like I said, like we all knew what was going on in each other's lives because we'd see each other once a week. It was kind of like any other activity that you would go to. Instead of being some like medical appointment thing that was kind of intimidating.
Yeah, good. I think the group classes do make such a big difference for a lot of, especially teenage girls, right? Like high school is hard enough as it is, and then you're adding this extra layer. What advice or what would you like to say to other girls, say they are newly diagnosed? So if you could give 2016 Hannah some advice.
Some advice?
Yeah, what would you say?
I think the biggest thing is that you're not the only person who's going through it. It's not as scary as it feels in the moment. There's so many other people who are going through the exact same thing as you, and all of the like insecurity that comes along with it, the if that's something that you go through. I know not everybody, but I definitely have. And then yeah, just your friends not understanding, even like your family doesn't know exactly what it is. It's your body, like you're the only one who knows how it feels and everything like that. You're definitely not alone. And then if physio is something that you're doing, keep up with physio. It definitely makes the biggest difference in how you feel, and just like dedicating time towards something that affects you that much, even if maybe you do have to get surgery or you're in a brace or anything like that. Working hard towards something that affects you every day is the biggest difference, because you, at the end of the day, you put in the most effort that you could, and you put in the time and dedication towards it. So I
like
think
investing
just
in
like
yourself.
Yeah,
Yeah,
and being proud of
regardless of the
yourself for
outcome.
doing that.
Yeah.
Yes, because it's not easy. So
yeah, taking the time to do exercises that make you feel strong and make you feel spend time with your body is it can be a very big part of self-care, especially when you are working through this condition.
Whether you have back pain or anything like that, if you're working on it, it is self-care, and it's important self-care. So
and you make a good point that the outcomes or the benefits of doing exercises are a lot to do with how you feel, that you feel stronger, that you feel more confident. So I think that's a really important point to make, because a lot of families, when they start physio or they start treatment for scoliosis, their primary concern is the size of the curve and the angles. And they're like, what can we do to change these angles? Which of course are important. But I love how you highlighted how exercise and all of that other self-care has so many other benefits other than just the x-ray outcome, you know?
Yeah, it definitely, because if you think about it, if you have the same curve, but you're not strong, you're not exercising, you're not moving your body in the right way, or if your curves and you have pain, or if your curves the exact same way, but you are exercising all the time and your muscles around it are stronger, so it's preventing it from getting any worse. And it's mental too. Like it definitely, if you're exercising and moving your body, and you, like I kind of said before, you're working towards something, it makes all the difference with your mental health, just mental well-being day to day. So not only is it physical, but you're also working on like your brain as well, I think.
Yeah, and getting all the other benefits of exercise that we all know exist.
Yes, there's a lot.
As you mentioned, you were diagnosed when you were 13 years old, that you found out that you had scoliosis. So how did you handle high school, especially when you had to get a plastic rigid brace?
Yeah, so that was probably one of the hardest parts, I think, was when I got the brace. You know, being someone who really likes clothes and all of that stuff, having to change what I was wearing, obviously, to cover it and everything. And going to school like that and wearing something that big on you every day, it was pretty tough. I remember going out shopping and getting some clothes that would work with it. So that definitely made a difference, because me and my mom kind of made it a fun thing. We just went out and we're like, okay, this is what this summer is going to look like. This is what I'm going to have to do. And then I remember sleeping with it was a lot at that time. And I think just the emotional, oh my gosh, I'm going to have to wear this all the time. It was scary and upsetting, But looking back now, it was such a small part of the 5 years of high school. I didn't have to be in it for that long, whereas some people do.
How did you tell your friends that you had a brace?
So I don't totally remember how I told them. It was kind of funny. Like some of them were just so good about it. They were like just, laughing with me about it. Some of them wanted to try it on. And then there were definitely people who, they just don't fully know like what you're actually going through and how hard it is. And not necessarily like super bad things, but I do remember people saying just like rude comments that I just didn't appreciate at the time because it was hard enough already.
Like, how did you respond, or how did you deal with when people have comments or made remarks?
I definitely took it to heart then. I think it was just because it was so scary and overwhelming already, and then I just didn't want I didn't want anyone else to talk about it. I just wanted to deal with it myself. And I think that, people who don't know exactly what it is that you're going through, they don't know how to respond to that stuff either. So I think just going in with the mindset of, like, this is what I have to deal with, nobody else is any part of it.
Yeah, and I remember at that time we had a long conversation about whether or not you should get a brace, right? Like we were kind of going back and forth and talking about the pros and cons. None of us made you wear the brace. We recommended it, but you ultimately, that was a decision that you made for your health. So I think that is also, that was one thing that I observed you do, was that you took responsibility for your health, and you were willing to have, people make comments because you knew you were doing something for you.
It was a rough time because it was over the summer. And you know what? Sometimes you have to make hard decisions. So I think that that's definitely one of them. And to anyone who is dealing with that right now, it is very hard.
Yeah, what your experience has been so valuable, and I've really watched you, from 13 to 19 almost. You've really matured and really grown in your self-acceptance and understanding that this is a part of your life now. And so I think you've really taken a hold of that and gone with it. And so I think that's a really inspiring thing that I think a lot of other girls can really relate to. So thank you so much for sharing your story and for taking your time to be with us today.
Thank you.